questions, but let me first start by saying we are truly committed to supporting everybody, individuals, families, providers, people who are self-directing, microboards, and thank you for understanding in this difficult time where we are with DDA. And again, I do apologize for not being able to get this starting on time due to technical difficulties. And so our highest priority basically is health and safety for everybody, including individuals, families, staff, and all of our provider community. We'll be reaching out and sharing with you recommendations as we move on. And let me just say, I truly admire all of the people that I've been interacting with. I've been hearing a lot from individuals and families. We had the opportunity this week to do 3 different calls, one for each of our regions, and hear from the providers what some of our challenges are. We know that some folks have made homemade face masks for folks. Others have provided video conferencing for recreation activities and games, and people are really getting very, very creative with being able to use remote videos, remote monitoring, Zoom, all kinds of things to interact with people and then figure out as we move forward how you can provide those supports by teleconferencing using those avenues. Remember that our fourth quarter payment should be out by the end of next week. And we will continue to support everybody with that fourth quarter payment. You should have it electronically on April 3rd. The 1135 waiver basically deals with our state plan services, including, since it is all Medicaid and we're one piece to our 3 waivers, our community pathways, our community support, and our family support waiver, but there's more to Medicaid than that. There is the managed care organizations that deal with behavioral health, etc. And so that was submitted 2 days ago, and it was approved yesterday. And there is a link on page 5 of our presentation that will bring you to what that area deals with. And again, it's state plan services. So what does that mean? That means that people for medical services, telehealth, those types of things, since many of our people who receive Medicaid get their health care services through a Medicaid provider. And also recognize that our targeted case management, so people who work as coordinating of community services for our not-for-profits in our counties, basically fall under the state plan. And so TCF has been a state plan since we began that a few years ago. So let's talk about Appendix K. That basically gets into more of what touches the providers, individuals, families, and what does that mean for us. So Appendix K, we finished yesterday. We've been working on it for quite a few days now. And we submitted it to Medicaid yesterday. They will be reviewing it. And then it goes from there to the Center for Medicaid and Medicare Services for final approval. And what it does is it temporarily relaxes the current rules and regulations that are in our appendices. And in our waiver application that was approved by CMS. So what we did is we obviously wrote on them, but what we did is we looked at other states. There were a few states, Nebraska being one, Pennsylvania being another one. And I think that there were 11 states as of a few days ago who basically had their Appendix K approved. What we did is we started looking at what was in the content from other states, and then we had the opportunity to have further discussions. So our Appendix K waiver will be for the 3 DDA waivers, and then Medicaid, through the Office of Long-Term Services and Supports, will be dealing with the other waivers in the state. As you know, there are 3 for us, but then there's the autism waiver, brain injury, the model waiver, adult medical daycare, et cetera, et cetera. And then that gets approved by Medicaid, and that goes to CMS, and hopefully that will be out relatively soon. So where did we get our input from? I had multiple conversations with the executive director of the DD Council of Max and of the ARC Maryland. Multiple calls. They've been extremely helpful with giving perspectives of either the providers or the DD Council and ARC Maryland with families. And so we also had conversations and input from the Self-Direction Advocacy Network. We've got over 1,000 people who are self-directing their services. We had conversations with and input from Service Coordination Inc. and families. I'm also thinking about case management as we move forward and still have the obligation to meet the needs of individuals that are in our supports. What does that look like? And so obviously we want to take a look at what other states did so we can learn from them, number one. Number 2, the input from the local people here in our state. And number 3, we use, as I mentioned earlier, technology better. So the relaxing of Appendix K and doing temporary modifications that relate to this pandemic, you can see on our website some of the details about Appendix K. Now, one of the things that we did in relaxing is case management, as an example, that will not have to do face-to-face, because we don't want somebody getting into a situation or having a team meeting with multiple people, rather if we can do it virtually. And so that's where we need to go. We need to be much better with what we're thinking about, how we're doing this in a different way of doing supports and services for individuals. And so what does it do? So it modifies our service requirements. But what does that mean? That means that case management, as an example, doesn't have to do case management face-to-face. That's all waived. What does it mean for our day folks, whether they be doing employment, etc.? That means that they can provide those supports in a residential site, which could be like job discovery and or whatever. Everybody's not going to be out working. We know that there's an executive order on closure of many businesses, which are affecting some of our people. We can exceed our service limitations and requirements. I can increase the payment rates, and we will include a retainer payment. This on the call yesterday came up multiple times, so I want to make sure that people totally understand what a retainer payment is. Basically, you would be receiving a payment, and a retainer payment is in what some of the other states have looked at. It's been in the guidance for Appendix K from CMS, and we will look at that. You know, my basic concern is we need to have financial stability currently for the providers so that you have staff, but you don't have people who you would be providing supports to. So what are you going to do with those staff? You need to maintain those staff. So that's what the retainer payment would be, to go to the provider agencies to pay a staff, regardless if they are doing supports or not doing supports. You know, sooner or later, you know, we're going to be over this pandemic. And then, you know, I think we're all concerned that do we have a workforce that's stable, or do agencies have to go out and start to recruit and not necessarily have the staff who have relationships who are current with the folks that we have. and looking forward, and what does that look like? So the retainer is extremely important. There's been a couple of questions about retainer. What does that look like for residential providers? If you provide residential services and don't do day services for an individual or 3 individuals living in a home, and the day provider is not going to go into your home to provide, the day provider is a different provider. And so if that provider does not want to go into the home to provide where the people are basically staying with the first provider, then the question has come up, so how do I pay for services for people that I'm providing days I wasn't getting paid for before? And we will be paying for that. So again, financial stability with our current, and as we go forward, moving in the future. So hopefully that's clear to everybody. You'll get an opportunity to answer some questions. Again, we're doing business totally different than we've done before. You can see on slide 11 that we want to expedite hiring, just modify, provide qualification, staff training, and onboarding. Some of the examples of what that means is we are being able to expedite, and we are temporarily waiving a lot of the essential trainings, and you will see this in guidance as we get the final approval in Appendix K and come up with a operational guidance. But one of the areas that we look at is, do people really need a high school diploma or a GED certificate at this point in time? And we are saying no. People can hire. People don't have to have a high school diploma or a GED. The issue is how to keep people safe and how to keep the supports in place for individuals. So again, on slide 12, I said earlier, raising limits. Our family support waiver currently is $12,500. Our community support waiver is $25,000, and you'll see they're both at $50,000. Let me use the family support waiver as an example. Schools are closed. We know that the state superintendent and the governor said they would be closed until the end of April, basically. And what does that mean if families has their son or daughter at home, school age, are in our waiver, and basically mom and dad work at the local grocery store or whatever, and that's one of the industries that's closed, obviously, by the executive order. And so then what happens to son or daughter during the day? $12,000 may or may not, depending upon what they've spent so far, have the ability to have somebody come in and do either personal supports or respite services, however we want to frame that, to assist that family. So that's why we raised that amount to $50,000. We can do meaningful day in homes, as I said earlier. We increased the limits by 360 hours for respite on top of what people currently have. We'll do an enhanced rate for people who are quarantined. I'm concerned that provider says I have a house that's quarantined, and people have tested positive for COVID-19, and that I think I should be able to pay my staff a lot more to come in and engage with somebody who's tested positive than somebody who hasn't within the agency. And so we will be enhancing those rates for people who are quarantined, who have tested positive, that we have staff from agencies going in there. Again, retainer payments, I can't stress this enough. I had 8 questions about retainer payments without reaching yesterday. Let me be totally clear. Retainer payments that are paid providers that have closed their day, employment, etc., and can't provide other services at this time. So it's an ability for you to pay your staff versus having to do furloughs or layoffs. All right, next steps. We're going to create a detailed guidance, as I said earlier, on operationalizing this, because I don't want you to have to go in as a provider, individual, family, somebody self-correcting, microboard, etc., and having to read what we had submitted to CMS. So we will take that and have operational guidance. It's I think something that you don't have to go in and take a look at. We should be able to provide that with what does this mean for me, as opposed to what did we submit in saying that we will have retainer days. Now, retainer days to CMS was in response to their instructions. Retainer days to the questions that came up when I did the calls with the regional offices are obviously different. Because it's like, well, what does that mean for me, and what does that mean for staff if I don't have anybody? I think we're providing active supports to. What does that mean? Well, it means we're just going to continue to pay you. Again, we've done on next slide 15. We've done the regional updates. I did East and West on Wednesday. Tuesday. I did South yesterday, and I did Central already. So we've got providers who basically have been furloughing staff. One of the challenges, and I understand this for our system, is that you have 100% general funds that come from the state. So we're not looking at match right now. But I've heard from providers 2 quarters from now, when we are talking to DDA and we did not provide those supports, will we have to return that money? The answer will be no, because we should have the approval from CMS with the retainer that will keep you whole. And so, again, I think keeping a workforce, having financial stability, et cetera, is where we really all need to be, so that we are not imploding our system, and we can continue to provide supports. We do have toolkits, as you'll see on slide 16. I'd ask you to go in and click on those links. Just take a look at where they are, and if there are certain questions, to feed them back through your regional directors so we can assist with that. We have done work with the Department of Labor. I mentioned that on last Friday's webinar, and obviously we want to remind you that there are additional resources out there, not just the DDA, that can hopefully assist everybody. You'll see on slide 18, we put in this layoff aversion fund with labor. There is a small business loan relief, etc. And obviously, there's a relief grant fund and United States Small Business Association, etc. So there's a lot of resources out there that I would ask you to just take a look at and where we go. The next slide also shows child care. We know that there were some questions initially with the first order that came out from the governor, the emergency order that basically listed a group. The second order that came out, if you look at number 1, letter H, it basically talks about companies and agencies that provide support to individuals with intellectual and developmental disabilities. Obviously, those child care programs will be provided by the state, and therefore essential and emergency personnel. Next slide basically gives you more child care resources, register online, MSDE, etc. And then there are obviously federal stimulus packages that are available, which is on slide 22. And then PPE, we have been working with Secretary Beatty and the Department of Disabilities. And they have statewide responsibility, and I don't know if a lot of people know that the Department of Disabilities is statewide strategic in situations like this for people with disabilities, not just IDP who have sight impairments or deaf, et cetera, that are outside of our scope. So we've been working with them. We had our director of QE send out to the providers asking what type of PPE do you need, so that we could get a sense of what the scope was. We then submitted that back to the Department of Disabilities, who, my understanding was, they gave that to the Maryland Emergency Management Agency, MEMA, and you will see that there's a link for that. My understanding is that the PPE is going out through the locals, Emergency Operations Center in each jurisdiction, and so you will have your requests go there, and not necessarily the DDA. We were coordinating that in conjunction with the Department of Disability. So I've seen a couple of emails that basically said we gave information to DDA and we had not heard anything back from them. I apologize if it wasn't clear on the front end that we were doing a surveillance, so that we would know what the scope was that we needed at that point in time. We also know that every day that there are more and more confirmed cases of COVID-19. That people are seeing the press release that the governor did this morning. He did one yesterday. The numbers just keep climbing every day. So we need to be safe, wash our hands, keep our social distance, and remember that we're all in this together, and I think that we'll get through this. It's just, I get to think right now it's just a matter of time. One of the questions that came up that I want to also go back on, and it may come up in a question, so I'm anticipating this. Excuse me, it's come up a couple of times this week. Is will you put in for retainer days? How many did you put in for? So residential right now gets 30 days, and if the provider can bill for that, the individual does not have to be present. Excuse me. So we added another 30 days. We added 30 days, retainer days for, and I'll say day, but that's day employment, CVS, all the stuff that would touch what somebody would do Monday through Friday throughout the day. So we added those days. That goes back to March 16th. So we're 2 weeks into this. We added hours for personal supports also. I can tell you that the feds basically have said that the Appendix K is a living document that you can go in and change it at any point in time. The question has come up a couple of times about, well, what if we exceed what the state has already requested with CMS? Excuse me. As we get closer to that figure, that number. And so if you think of day services as an example, and we looked at that, that would probably be about 6 weeks with the total amount that we had requested, since it's a Monday through Friday, etc. So having said that, I think I'll stop now and start taking questions. We got about 15 minutes. Again, I truly apologize for our technical difficulties here in DDA and starting late.
All right, Bernie, so can you hear me? And I'll read the question, and then you can provide the answer. If CARES passes, will providers be provided supplemental funds to increase staff wages? Also, can the Appendix K be put on the DDA website?
It will be put on the DDA website once it's approved by Center for Medicare and Medicaid Services, along with our operational guidance. I would ask people to go in and also sign up to our constant contact, and we should be pushing this out through that, as well as our abilities through PCIS to get this out. I didn't hear the first part of the question.
It says that if CARES passes, will providers be provided supplemental funds to increase staff wages?
I don't know. We have to go back and view that.
Okay. How do I know caregivers are following social distancing when away from assisted living, and how do I maintain biweekly visits with siblings to know if they're okay?
Well, I think you do that through either a visit and, making sure that, you're as we see on the news at times, people are talking to people through the window. I don't necessarily recommend that, but I think that there's a way that we can get through communications, either through cell phones, if people have that availability, through Skype, through some type of technology. I don't know how we ensure that people are keeping their social distance. I mean, you heard the governor the other day, he was a little concerned when he said that people were not doing a lot of social distancing, and he was concerned about that. I think we all are. I can tell you that, I'm not so sure that the grocery stores, and I'm not picking on them, but, people standing on a checkout line. I mean, I don't know if they're standing 6 feet apart or not. I know they weren't when I was there last week, but, and I know we all experienced that. I think it's a new concept to keep that distance, and I think just we need to be conscious of it and just politely remind people.
Okay. Can self-directed staff file for unemployment if their hours are significantly reduced?
Well, the people who are self-directing are also eligible for retainer pay. So I'm not so sure that there'd be a need to reduce the hours and force that individual to go to and collect unemployment benefits. I would hope that the retainer that any approval from the feds would assist in that situation.
Please let us know what you are doing for participants who are employed or are about to start jobs, but their agencies have closed and transportation supports are not available. What is the guidance to agencies if participants use public transportation, but there's no public transportation?
Well, I think we have to ask the agencies what if they don't have any resources, why don't they? I know that once we get approval, we will put everything out about the retainer fee. The agencies have the capability then of bringing their staff back who are either furloughed or displaced from the agency. And then the question is, what does transportation look like? I think the more important question is, what does the job look like, where they're going, and is it still a viable opportunity, or do these people really, they're shutting down more and more businesses. It started with a group. It's expanded since then. I'm not so sure that with the numbers continue growing, what that will look like in the future. So I think we need to be more mindful of somebody's health and safety, and is there an alternative activity? I know people would say, we don't want to jeopardize our job, but under the current circumstances, I think that the reasonable thing to do might be, maybe we delay starting some of these employment activities. As you may start, you might find yourself a week later that that business isn't open either.
So Bernie, there's several questions about retainer payments and how do you submit timesheets and what did you do to mark down the hours and explain. As you heard Bernie speak earlier, that he is going to have operational guidance for Appendix K with all the do, what, how, and when to operationalize what providers will need to do. So we would want you to, go ahead, Bernie.
That's exactly right. I mean, the frustration that you're going to have as an agency or somebody self-directing, being the employer, is that you're going to look at Appendix K, and it's going to say, oh yeah, we've approved retainer days for these 3 waivers that within the Developmental Disabilities Administration in the state of Maryland. That's all it's going to say, approval. Now you're into the operational, which is why I said earlier, and as Patricia just picked up, operational guidance is going to be able to say to you, when you get retainer days, this is the expectation. And again, where everything is relaxed, and I can't stress this enough, we will not have you do a mountain of paperwork to verify this and validate this. We're going to have to figure out some type of process so that I know that when we give a payment to an agency, that the agency is going to say to me, oh yeah, we had people furloughed, we got the retainer payment, and we passed it on to them so that they will remain active employees when we get back to quote unquote normal when this pandemic is over.
So are you saying that we are allowed to provide day hab services in individual homes?
Yes.
So for those individuals using self-directed services, is there a different code of which they should use or indicate the time is being justified under Appendix K?
That'll be in the operational guidelines. I mean, at some point, I think that we may be asked by CMS, so you got additional days, how were those days spent? So we may have to think about how we're going to be doing coding in DDA. But again, I don't want to make this burdensome on anybody. So we've got DDA and the staff will be thinking this through about how simple can we keep this, but being able to verify when requested how the funds were distributed.
There's another question here. What is the methodology for retaining staff under self-direction?
I don't know what that question means. The methodology for retaining staff under self-direction?
Yes, that is the question.
Well, if somebody's self-directing, and I think it depends upon the service. I mean, if somebody's self-directing, they got people coming into their home, and for evenings and nights, obviously you'd be keeping that staff. If you are self-directing these services and you don't have the ability to participate out in the community without, exposing yourself to COVID-19, or your current employment is temporarily closed or whatever, you would still have the capability of using those day supports from that staff in your own home.
So Bernie, I'm getting a lot of questions about can FMS approve budget mods and service mods? And so one of the things that you'll notice and that Bernie asked you to do at the beginning of the webinar is to please download this presentation, because there's over 40 plus slides and he only presented on 20. The other slides give you a detailed information of what's in Appendix K, and some of these questions will be answered by reading that, the additional slides. So if you go through that. And then the other question is, will there be further specific guidance or changes to K? And Bernie said that as CMS considers Appendix K a living document, and we can make changes accordingly. Okay, I think we're going to do about 3 more.
Let me just give an example, because as you said that, and that was a good point. So the last couple of questions are around people who are self-directing. When you see this, I would ask the people who are on the phone who are self-directing their services to look at slide 39. And you see that it talks about how to modify services, that there will be a budget of $2,000 funding increase, and where that could be utilized. Increased support broker hours, staff recruitment, PPE if you're not getting it from the local jurisdiction, increased personal supports, et cetera, et cetera. So we've addressed a lot of this stuff. I did not plan on going through this. We planned on stopping at slide 24. But again, I think to have additional information, which may then generate some more questions. I would entertain those questions. I think they'd be great. They might inform us when we look at Appendix K if we need additional changes or modifications or enhancements. Again, it's a living document.
There's several questions, Bernie, about the laid off fund aversion fund is out of money. And so they wanted to know what can DDA do to advocate for more funds.
So tell me what the fund is from where?
The layoff aversion fund.
Well, I think that's, I think one of the things that we need to continue to think about is that, the agencies that we work with are 501c3s. I don't necessarily have authority that when it comes to these not-for-profits, because they do have a board of directors. I've been getting emails from agencies around the state who were telling me that their board of directors are concerned that in the future they may not have enough funding because if they keep their current staff with in knowing that they've got general funds, even with the next quarterly payment going out, that they will be taking action currently so that they don't have that liability in the future. There are certain things that that are beyond the scope of DDA. And I think we will continue to advocate. I am concerned that we, again, have, and I can't stress this enough, financial stability. What does that look like? Again, that's why I put in for as many as retainer days as we did. We will continue to watch that to say it started on March 16th with people being out of work, being furloughed, being reduction in hours, etc. And as we get to the end of those 30 days for our day, employment, etc., when we get down to day 25 and it's like there's 5 days left and it doesn't look like that there's going to be any relief and the restrictions are still going to be in place, we will go back through Medicaid to CMS and increase those days so the providers can stay home.
Okay.
We need to end this. I have a 2 o'clock webinar also.
Yeah, it is 2 o'clock now, Bernie, so thank you.
All right, so again, let me just say this. I want to thank everybody for being on the phone. I want to thank everybody, not just for being on the phone, but for everything you're doing. It's a very, very challenging time, and it's not just for all of our folks and supports, it's also for your staff. I mean, everybody's out of sync, everybody's out of a routine, especially if they're, in home, or if you're home with dad and mom, because we know we've got about 16,000 or so people who are in supports on our waivers. Of that, there's about 6,000 in residential, so we get a lot of people in other circumstances and situations. So we need to make sure that we're clearly communicating, and I will continue to advocate for you for what we need now, and so that, again, in the future, when this is behind us, that we don't have, that we still have the capability of providing supports and services. So with that, I want to thank everybody for being on the call. I want to thank you. Once again, stay safe and send me emails or whatever you think so that you can keep me informed of what your situation is. Thank you.